I am Dr. Ram Narayan, consultant function neurosurgeon. I have been talking about various procedures, surgical procedures, which will help in improving the functional quality of life of patients. And in this category, one of the commonest problem, especially in the elderly, is paralysis of one side of the body, which we medically call as a stroke. Stroke happens because some or more areas of the brain gets affected. Either there is a lack of blood supply because there is a clotting of the blood vessel, which prevents blood from flowing to some parts of the brain or big parts of the brain, or there is a bleeding into the brain, which happens in some situations like uncontrolled blood pressure and all that. In both the situations, that area of the brains get damaged and the function that is subserved by that area of the brain gets affected. So stroke is of various types, but the commonest that we see is hemiplegic stroke. That is, one side of the body gets affected. That is, one side, hand and leg gets affected. It can be either the left side or the right side. There may be other associated features like loss of speech or visual disturbances and all that. I am not going into those at this time. When one side of the body is affected, obviously the patient's ability to do his work, his functions are affected. So walking, using his hands to feed himself, dress himself, his personal activities, they are all affected. Especially if the right side, right hand and right leg are affected, it really cripples the patient because most of them use the right hand for most of our activities. What is the treatment for this condition? Of course, treatment of stroke is different. There are various treatments, including, initially within the first 2-3 hours, you can completely dissolve the clot using various medications like RTP and all that. Then surgery is an option in some patients, especially when there's a big blood clot and all that, surgery is an option. So my topic today is not related to that. My topic is related to patients who had a stroke and who have stroke about a few weeks or few months back and who are really crippled. Most of them are wheelchair bound or not able to walk, bed bound and all that. That is rehabilitation for stroke patients. After a stroke, once the acute process is over, the doctors advise the patient to start physiotherapy. By physiotherapy, some patients may benefit, but it is a very less numbers. The main reason is that the one side hands and leg becomes very stiff, which we call spasticity. Unfortunately, any amount of physiotherapy does not control the spasticity. So what do? We do what is called as intrathecal baclofen pump. That is, we put a pump under the skin of the abdomen here and deliver a drug called baclofen into the spinal cord and the brain. And this drug will reduce the stiffness of the hands and the legs, especially the right hand. When the stiffness is reduced, then the physiotherapist can do his work and make the patient become normal. Intrathecal baclofen pump for stroke is a very well accepted treatment and the results are usually very good. And most important is we always do a trial before the surgery to see whether the patient is going to benefit from the surgery. So we put 1 ml of baclofen into the CSF and see for 4 to 5 hours whether the patient's hands and legs improve in their movements. Then only we offer the surgery. If the trial is negative, we generally don't offer the surgery. Thank you.